At Saskatoon's largest hospital, nurses are reporting major concerns of overcrowding and a system at a standstill.
They had a full emergency department, but they also had 21 patients on stretchers. So when you think of a full emergency department and every bed and all of the people packed into a waiting room, and then you have 21 people on stretchers surrounding the desks and down the hallways and under those bright fluorescent lights, it's very stressful.
Hey, hey, ho, ho! Unsafe staffing's gotta go!
She says capacity issues aren't a new concern. Nurses have been speaking out for months, but the situation is getting progressively worse.
It's a problem doesn't appear to be addressed. If it was, then we wouldn't have our members reaching out to us and saying, look, nothing's changing. We have ideas. We don't feel like anybody's listening to us.
She says that the overcrowding issues are a major safety concern for patients, and many nurses are at their breaking point.
I just can't imagine the mental health issues, the anguish that nurses are going through, just the moral, how it makes them feel knowing that they're not able to give the care that they believe they should give, that they're legislated to give. They have a professional responsibility to give. And it becomes very, very difficult for them to continue that day after day.
Saskatchewan's health minister says he's aware of the pressures and the provincial health authority is trying to address them.
The funding that was provided for the Saskatoon Capacity Pressure Action Plan is meant to address some of these concerns, giving them funding to hire more staff so they have more staff in emergency departments, providing whenever we can, try to find opportunities for space within these facilities and doing what we can with what we have for the existing space and staff. But there's been significant progress made by the SHA in hiring staff to fill those vacancies, to bring more people onto the ground, to work very closely.
The minister says he plans to tour hospitals and hear from nurses. The union says there is an urgent need to listen, but also take action, guided by what the nurses say. Kendall Latimer, CBC News, Saskatoon.